Okay, this is our trach suctioning video. We actually have these two that are going to go hand in hand, trach suctioning and trach care. Be aware that trach suctioning can be done as often as needed. Usually that's how it's going to be ordered. We want to maintain the patient's breathing, clear out, keep their lungs as clear as possible throughout the day. So like I said, so suctioning can be done several times throughout the day, where trach cares are usually only done once a day or possibly twice a day. So anyway, so like I said, this is the pass off for the trach suctioning. So first off, we're going to check our orders to make sure that there is an order to be able to suction the patient. I'm going to gather all of our supplies and bring it here in the room. So I've got my suction catheter kit, I've got my pulse ox, I've got my normal saline here that I brought in with me. I'm going to ID the patient, and with the trach patient, they're not going to be able to talk to us, so they're not going to be able to say their name. So we would come and say, okay, you're Kit Kat, your birthday's 9/29/1985, and they would nod their head and agree that that is who they are. But just be aware with the trach, unless they've got a Passy-Muir valve on their trach, they're not going to be able to speak. We're going to explain this to the patient, and like I said, usually we're going to know when they need to be suctioning. They're going to be rattly and gunky. We're going to audibly be able to hear the need for suctioning. So, we can come to say to the patient, oh, it sounds like you're needing to be suctioned. You think we need to suction you now? And, they're going to be, yeah, let's get this taken care of. We're going to provide privacy, close the door, close the curtains. I'm going to wash my hands. You're going to use hand sanitizer, whichever the case may be. We're going to put the patient in a semi-Fowler's position, so they're kind of there, but maybe raise them up a smidgen more. Lower that foot of that bed. I'm also going to get my suction tubing here. I want it right here ready where I can grab it easily as I need it. So I'm going to set here on their pillow, turn the suction on to regular suction, and then usually full vac is what we're going to want. We want pretty good suctioning. I'm also going to hyper oxygenate the patient. So I'm going to grab the mask here, maybe. And this is a mask for a patient with a trach. It will fit around their neck, but I'm not going to put that on right now because I'm needing to remove it. So I'm just going to set this here on their chest. And we want to hyper oxygenate them for at least a minute before we start the suctioning. I've got my pulse ox here, and I'm also going to put that on their thumb so I can monitor their oxygen saturations throughout the suctioning, because if their sats were to drop down low, I'm going to stop the suctioning and immediately put the oxygen back on them. So anyway, if the patient is on oxygen, we are going to bump that oxygen up 4 or 5 liters more than what they've already on. If they're not on oxygen, we're going to put the oxygen on 4 or 5 liters for this hyperoxygenation. So anyway, so I've got the patient ready. While that minute is going by, I can come over here and I can get my kit ready. So again, this is a sterile procedure. So I would open my kit, and inside of the kit there's going to be a package almost like we would see with our gloves. But it has this little box on the inside that I'm going to carefully try to slide out here onto that wrapper and slide it away. And then again, if I open this, you're going to see that there's a pair of gloves and then our suction catheter. This got some moisture on it because I've reused this, so pretend that's not there. But anyway, fold this down so it's not going to fold up on it. So I'm going to put the one glove on at first. So I'm going to put the glove on my dominant hand. So for me, that's going to be my right hand. So I'm going to kind of slide this down here a smidgen because I don't want to cross this sterile field. I'm going to kind of press this down. And then I'm going to come over here and I'm going to grab this box. And with this box, with this gloved hand, I'm going to squeeze it and open it up. And you can see it's just a cardboard box, and it's got a plastic liner in it. So I'm going to kind of set it here on the side of my wrapper. And I'm going to come here again, avoiding that sterile field. I'm going to grab my container of NS. And I'm going to remove the lid, and I'm going to place the lid down like this on over the bed table. I'm going to do what is called lipping of this container, and it's just going to clean off the edge a little bit. Again, keeping my sterile glove up here, but I'm just pouring a little bit of that water into the garbage to kind of wipe off the rim of this container. And then I'm going to pour some here into my little box. You don't want to splash it onto my sterile fill. And again, put my lid on it. If this were a new bottle, I'm going to label this and date it before it's used again. So we want to make sure that it's a fresh bottle. So again, so at this point, I've got all my supplies ready, and I'm going to come and I'm going to put my second glove on. So again, here with grabbing it on underneath the cuff, I'm going to come and I'm going to put this second glove on. Maybe if I folded it properly. Okay, like so. So I've got my second glove on. So at this point, like I said, with my two sterile gloves, I can come over here and I can get my catheter out. So you can see here that this is my suction catheter. So I'm going to grasp this with my sterile glove, and I'm going to wrap this around this hand until I only have the little port here left out. So anyway, at this point, like I said, it's going to turn into like the catheter, where we have one hand that is not sterile and the other one that is sterile. So my left hand, now I'm going to come and remove my oxygen. So I can move it down here so I get a little bit of oxygen by blow-by, or I can completely remove it at this point. But anyway, I'll just kind of move it down there. And then I'm going to come here and again check my suction again, make sure that it is where it's set to be, and then I'm going to come here and I'm going to grab my suction tubing. So at this point, like I said, this hand is no longer sterile and this one still is sterile. But I want to be careful that I'm not going to contaminate it. So I'm going to connect these together. So at this point, like I said, it's being careful not to let my left hand now touch the tubing or my right hand. My left hand is what is going to control the suction by putting my thumb over this little port right here. So anyway, so it is the one that will control the suction. So then I'm going to, from here, carefully release the suction until I'm holding on to the tip of it, and I'm going to, again, hold onto it like a pencil. So I'm ready to go with my suctioning. Again, not putting suction on. You don't apply suction as you go enter the trach. But anyway, so I'm going to insert it into the trach until I reach that bifurcation. And you usually know that the patient will kind of gag a little bit as you hit that bifurcation. So I'm going to hit that, and then I'm going to come up about another inch. And once I've come up to that 1 inch, I'm then going to apply the suction with my left thumb. And again, turning and twisting this tubing as I pull it out. So you only want to suction for about 10 seconds. So again, and once I've done that, for about 10 seconds, then I'm going to come over here and I'm going to, again, insert this into my normal saline, and again, apply suction here to suck up and clear out the tubing of any mucus that I may have gathered as I was suctioning. So again, may have to do that several times to try to keep that tube clean. Then I would come back over here again, and maybe you guys can't see this too well with that in the way. But anyway, I would do that second time, insert it. Again, not touching this with my glove until I reach that bifurcation, pull back an inch, apply suction, and again, twisting and turning this as I pull this out. Again, come over here to my water, my NS, apply suction, again, cleaning out the tube. You want to do this in the paper, or in our paper, it says to do it no more than 3 times. But basically, you want to do this until the patient's lungs are clear. You may need to re-hyper-oxygenate the patient, wait 30 seconds in between, but basically you want to suction until their lungs are clear. Sometimes they can get a mucus plug in there, and like I said, sometimes it takes a lot of work to get that out, but we want to we're suctioning for a reason to, to clear the lungs, and so again, we're going to suction until they're sounding pretty clear. But anyway, we want to, we only want to suction when it's needed. There shouldn't be like a scheduled, every 4 hour suctioning. Again, it just needs to be whenever the patient needs it. And again, wait for that 30 seconds in between each suctioning. We don't want to use normal saline. You'll see some nurses that will use the little saline bullets and squirt it right into the trach and then suction that out. But again, that's going right into their lungs, and so we don't want to do that. So anyway, so at that point, like I said, we can disconnect our suctioning. We can gather up our tubing in our gloves, encase that in our double gloves, and dispose of it in a biohazard bag. And again, at that point, I'm going to come here and I'm going to assess the lungs again with my stethoscope. Again, go over the lung sounds, making sure that they should sound better at this point after we have suctioned them out. In the paper, it says to leave your gloves on during that, and then make sure you're cleaning your stethoscope off because you've touched your stethoscope with your gloves that you just suctioned them with. But like I said, I like to take mine off first, but it's probably not a bad idea to clean your stethoscope off, just because patient with trachs and suctioning, and technically we should have PPEs on, mask, gown, and goggles, again depending on what our patient has, because again, it's the likelihood of splatter can be there with the suctioning. So again, making sure we're cleaning our stethoscope off and keeping ourselves protected. So get rid of my supplies here, clean up my supplies. I'm going to return that patient to a position of comfort, and then I would document the procedure, how the patient tolerated it. The secretions, we want to document the color of the secretions and the amount that we were able to obtain. But that's how we do trach suctioning.